Hi, my name is Jordan Lawley, and today I will be going over definitions of some of the topics that we've learned over the last few chapters that we have been reading, starting with disease, which is an illness that one is born with or acquires that causes disruptions to the normal functionings of the body. For example, type 1 diabetes would be a disease, and the way that we classify a disease like type 1 diabetes is based on the clinical manifestations, including the signs and symptoms, and as we will further discuss, how the disease moves through the body. And the etiology, or the cause of the disease, it can include a variety of different factors like biological factors, physical forces, chemical agents, genetic inheritance, how much you eat, how much you don't eat. There's many different etiologies, different causes of disease. For example, someone who has a low iron, this may be due to a nutritional deficit, and that is one specific etiology cause of this disease. And then the next concept is pathogenesis, which is the development of a disease through the body. So it's the different events that occur from the start of acquiring a disease and then throughout the development of a disease. So for example, the way that a heart attack develops, we first see plaque forming, and as that plaque it becomes to form together in a big clump, and eventually that plaque will rupture, which can cause a clot once that plaque enters the bloodstream, the different proteins, and that will cause blood flow to stop, which then leads to a lack of oxygen, which can then cause that event, that ischemic attack. And then we can, in very severe cases, see necrosis, death, if it is not dealt with at a proper timing. So again, there's these sequence of events that occur from the beginning of the start of the disease and then to the end, and there are different variations of what can happen depending on the interventions, but the pathogenesis is typically what we see from start to the end of a disease. And then going back to what we were saying about disease classification, the different signs and symptoms are what helps us to classify diseases. However, there is a difference between the two. Symptoms are subjective, so they're not measurable, they cannot be seen. It is what a patient is telling you they are experiencing. So for example, if a patient is telling you that they are feeling pain, a burning on their skin or a dull, constant pain, that is something that you cannot see. It is something that is expressed. So again, that subjective symptom, it cannot by a doctor be measured or someone outside of the person experiencing it. And then a sign is an observable, measurable thing that can be seen and measured in a numeric way. So for example, like an elevated temperature, you see a patient with 100 degrees temperature, you are able to identify that as a sign. Or for example, an elevated blood pressure. Again, you can measure that, see that with numbers. It is not something that can only be expressed. It is something that is measured. And then after you have established the different signs and symptoms, you are able to diagnose a patient, meaning the nature or cause of a health problem. So you're defining what is causing the disease, as well as what from these causes you are currently dealing with. So for example, a heart attack, after someone has expressed chest pain, shortness of breath, they're feeling muscle twitches or spasms, you can then come to a diagnosis after observing the patient and getting vitals that they have a heart attack. So that heart attack would be the diagnosis based on all of the evidence that you're collecting. And then complications of a disease are those possible adverse events that can come from a disease or an outcome from treatment. So for example, people going through chemotherapy tend to get sick from the chemotherapy. So that is a complication of the treatment. Or there are, again, complications of a disease. So for example, type 1 diabetes, those who do not control their blood sugar properly over time can develop diabetic neuropathy, which can lead to nerve damage and has an array of different problems that can come from nerve damage. So again, that is a complication of the disease. And a prognosis for a disease is the probable outcome and prospect of a recovery from a disease. So that probable outcome would be whether or not you can foresee treatment being successful and in what amount of time. And then there's the other side of it where maybe there's not a treatment available, or it's not likely that a treatment will work. So your prognosis may be an amount of time, or the chances of someone surviving that disease with or without a treatment. So how long they are, they foresee someone living with a disease until it takes over, whether with or without treatment. So there can be, a medical professional explaining your prognosis for a disease with treatment and without, so you can see the benefits. And lastly, we have diagnostic testing. So they're ordered to validate everything that we have talked about, like that diagnosis, those signs and symptoms. They get blood tests to see where you're at. So they'll look at the normal blood levels of a person and then compare that to yours. And if something is out of range, those abnormal levels can show you, can solidify what you thought was the problem. So for example, someone who is displaying the signs of diabetes, there's excessive thirst, tired, that fatigue, getting someone's A1C may show exactly what you thought. Maybe their blood sugar is higher than normal, and further testing can be done to validate, but that A1C is a good marker initially to tell if someone has diabetes. And then further, you can do more blood tests to find out what in the body's levels may have changed already, or see what needs to be adjusted treatment-wise, and again, to validate what a doctor may think the problem is. Thank you so much for your time.